Dr. Ellen. Thank you so much for joining us today. We're super excited to have you on our show, and so are our listeners. We've collected some questions from our community, but I wanted to first start by asking you a little bit about yourself. So, Ellen, can you tell us what made you choose to study urology and specialize in male infertility?
Thank you very much, Sarah, and thank you for having me on here. It's a pleasure to be with you and continue our work together that began over a decade ago in medical school. When I was in medical school, I didn't really know anything about urology at all. It wasn't on my radar, so to speak. But when I went through training during medical school, I tried to rotate through everything I could and keep an open mind so that I could figure out what I enjoyed the most. And I definitely gravitated towards the surgical specialties. So that helped me narrow my focus to surgical specialties. And I tried those all as well, as many as I could. And urology is kind of a hidden gem. It has a great variety of cases, major surgeries, removing bladders and kidneys, kidney transplants, things like that. But also lots of minor but highly technical procedures such as treating kidney stones, ureteroscopies, microsurgeries, so a huge variety. And urologists are generally pretty happy and pleasant people to be around. So I immediately sort of gravitated towards the personality of the specialty. So I pursued my urology residency, as you said, in Alberta. During that residency training, I didn't really have any exposure to male infertility because there was no male infertility specialist in Edmonton at the time. So I set up some electives more as an educational goal. But once I was exposed to it, I really found it fascinating. It's a very rewarding specialty, obviously, trying to help couples achieve pregnancy. And it's also challenging. There's a lot of microsurgery. It's very delicate. And so I really enjoyed that aspect of it and pursued my training in my fellowship in Toronto, which is one of the top male infertility programs in the world. So yeah, that's my story.
That's cool. Thanks for sharing that. And what's funny is that even though we're good friends, I don't think I ever asked you why you chose male infertility. So now I know.
Yeah, there you go.
The next thing, I'm just wondering if you can sort of walk us through your training and what it involves, because I don't think people always understand how much training some people have to go through to achieve the careers that they're in today.
Right. That's a great question. So in Canada, generally speaking, before starting medical school, there's 4 years of an undergraduate degree. Mine was a Bachelor of Science degree, followed by 4 years of medical school. So that's 8 years. And then a further 5 years of a surgical residency. So for me, that was urology. And on top of that, although this part is optional, most residents that graduate these days will also pursue subspecialty training, which is called a fellowship. And that's an additional 1 or 2 years. So, in total, it's about 14 or 15 years of post-secondary education.
Yeah, I was doing the math in my head while you were saying that. So that is 15 years of schooling after high school.
That's right, yeah.
Good on you, sister.
Yeah.
Thanks for sharing. And I think it's important for listeners to understand the investment that you make in your education, especially with respect to time.
Mm-hmm.
So now I'm wondering if you want to dive in to telling us what your top 5 tips are.
Yeah, sure.
About male fertility and infertility.
Yes, I would love to. So my first tip is maybe not so much a tip as a general recommendation and approach to fertility. So a lot of fertility work or burden, so to speak, falls often to the female partner. And certainly there is a slight preponderance of fertility issues on the female side, especially with advanced maternal age, etc. However, infertility is really a couple's problem, and it should be approached as such. You really need to take a team-based approach and remember that the male partner can be contributing a significant proportion of the time. So studies have shown anywhere from 40 to 70% of infertile couples can have a problem on the male side. Most studies say it's about 50%. So about 20 to 30% of the time, he's going to be the only problem, so to speak, and another 20 or 30%, he's going to be part of the problem. So it's really important to look at the male partner when you're being evaluated for infertility. And if you're struggling to get pregnant, to remember to get him checked out as well. That's really important as sort of the first step in approaching the infertility picture.
That's a really great point. And I think, the team approach as a team from the beginning is so important. Like, you're a parent.
You're going to be a team for a long time, hopefully. Yeah. So you might as well buy into it right from the get-go and do your part, right?
Excellent. Yeah. So tip number 1, approach it as a team. Thank you.
Yeah. Tip number 2 would be to not smoke. So both marijuana and cigarettes have been shown to have a pretty significant negative impact on sperm in slightly different ways. Cigarettes obviously are unhealthy for a myriad reasons, and their effect on sperm is no different. They increase the DNA fragmentation and they lower the overall counts, and in general, smokers do not have as healthy sperm. And so that's kind of a very straightforward recommendation. Marijuana is something that a lot of people are a little bit more surprised by, and I'm surprised, certainly at the amount of marijuana smokers, that you wouldn't realize. So when you do take a history, I always ask about marijuana use, and it's a significant portion of the population that uses it on a regular basis, which is fine. But I think that a lot of couples struggling with infertility aren't aware that marijuana use can negatively impact sperm. There's the cannabinoid receptors essentially in the testicles. So marijuana is essentially acting like a negative feedback in terms of sperm production. And so it can lower not only the health of your sperm, but also the sperm counts, especially with regular daily use. So I usually counsel couples that, if they dabble in it, that's one thing. But if they're really regular daily heavy users of marijuana, that's something that they really need to work on, at least, temporarily cutting that down or cutting that out to try and improve their sperm counts, So even if they can get down to just, pick once a week when you're really stressed, and if that's when you use it, then that's when you use it. But the daily use can certainly negatively impact sperm.
And am I correct in understanding that because there are endocannabinoid receptors, that even if you're not smoking, but you're ingesting another form, like edibles, would have the same impact?
Yes. Yeah. If it has the cannabinoids.
I know. It's a big, long word.
Exactly.
Yeah. And it's interesting because it has the same impact on female fertility as well.
Oh, really?
Yeah.
Oh,
There's endocannabinoid receptors in the ovaries and everywhere.
Yes.
It's fascinating.
Yeah.
Okay. So before I take over and start talking about female fertility, we'll get back to Dr. Ellen. So tip number 2, don't smoke, don't use marijuana or ingestible cannabis. Thank you.
There you go.
Yeah.
Tip number 3 is to avoid excessive heat. So there's a reason why the testicles exist outside of the body, and it's because the ideal temperature for sperm production is a bit cooler than the temperature of the rest of the body. And so that's really why they exist in the scrotum, so that, when you're warm, the scrotum relaxes to try and get the testicles further away from the body to cool them down. And when you're hot, it brings them up. But generally, they like to be cool. So things that increase the temperature of the scrotum, such as regular hot tub use, or one of the older versions of a laptop, the ones that get really warm, if that's on your lap, or even sometimes we think this is what plays a role in certain excessive cycling effects on sperm. Anything that overheats the scrotum is negative. It has a negative impact on sperm production. So if patients have a hot tub at home that they use on a regular basis, I tell them, that they either have to cut it out completely or, do just the legs for a few minutes. Try not to get excessive heat exposure in the scrotum.
That's a great tip. That one I would want to hear because I love
a
good
tub.
hot tub.
I know.
Oh,
me too.
I sure do, girl.
Yeah, I miss my hot tubs right now.
So I know, right? Oh my gosh. Ellen's pregnant. That's why she's missing her head
Yes,
today.
exactly. So sacrifices,
Yeah,
right? Yeah,
it's a small sacrifice to make.
it's true.
Although it doesn't always feel like it.
Yeah.
Okay, so tip number 3 is avoid excessive heat. Thank you, Ellen.
So tip number 4 would be to eat a balanced diet or eat well. So we all know that a diet is good in general. Specifically in terms of male infertility, if you have a diet that's filled with sort of that nutrient poor food, high calorie food, it's just really not providing the testicles with the ingredients they need to produce healthy sperm. So there's a multitude of different vitamins that are essential for healthy sperm production, things like zinc, folate, vitamin A, C, D, and E. And when you're just eating an unhealthy diet, you're just not providing your body with those nutrients that it needs to make healthy sperm. So we really recommend a balanced diet. Lots of vegetables, green leafy vegetables, fruit, fish is really good because it's high in omega-3s. Shellfish is good as well. And there's a few men's health multivitamins that are really good as well. There's a couple that are designed specifically for increasing the health of your sperm. So if you're trying to get the best one, then you can sort of search those out specifically. If you looked for sperm health vitamins, then they would likely have all the necessary ingredients. But even just a regular men's one a day is a good way to make sure that you're getting those nutrients in the quantities that are necessary.
That's great. You know, I as a family practitioner, I do see couples with infertility before they go on to see a specialist. And that's not a tip I ever thought was to recommend the male partner to take a multivitamin.
Yeah.
So I've learned something today too. Thank you.
Go.
Okay, so tip number 4 was eat well, a balanced, healthy diet. And that's a great tip for the female partner as well.
Yeah, you get a multivitamin into each one of you.
Get into yes.
Yeah.
Get her into yes. That's the East Coast in us. Okay, and let's hear your last tip, Dr. Ellen.
So my last tip would be something that, again, a lot of people don't seem to be aware of as a risk factor for male infertility, and that's the use of testosterone and steroids. So you would think, by the sounds of it, that testosterone, if anything, would boost your vitality and boost your fertility, and it's kind of associated with all of those things, but the body sees it in a very different and interesting way. So the body needs high levels of testosterone within the testicles for sperm production. But when the body reads that you're getting testosterone from outside, so you're injecting or you have some other outside source of testosterone or anabolic steroids, the body reads that as, oh, there's lots of testosterone floating around. I don't have to work to make any. And the testicular production of testosterone actually drops. And as a result, sperm production drops. And because of that, testosterone's actually been studied as a male contraceptive because it will often drop the sperm counts quite drastically, even to 0.
Wow.
And so sometimes I do see couples who, they've been trying to achieve pregnancy for a few years and the male partner has been on testosterone and he's getting it sometimes even from his family doctor.
Yeah.
Because it's just something that people don't realize. And so, we look at their sperm count and it's 0 and it's often because of the testosterone use. And so testosterone from the body is good, which is one of the reasons why exercise is good because it increases your body's own production of testosterone, but testosterone from outside the body is bad.
Very interesting and good for us to know as family providers. Now, what about like other, steroids?
Yeah, so
anabolic
steroids.
Yeah.
They have a similar negative impact. I try to counsel couples, I do realize that lots of these men who use testosterone or anabolic steroids have been on them for quite a long time and they feel quite reliant on them for their mental health and overall fitness and well-being. And I do understand that. So I try to take an approach that the patient, we approach it as a team, and I typically offer an alternative because there are medications like Clomid, for example, which is used in female fertility, and HCG and things like that, which can sort of trick the body into producing its own higher levels of testosterone. And if we approach it in that way, it actually increases your sperm production. So we can
Interesting.
potentially increase your testosterone and your sperm production by using a different medication. And it's really a temporary thing. If you feel better on the testosterone from outside the body, then you could potentially go back on that once you achieve a pregnancy. But the thing to keep in mind is, in terms of sperm production, everything takes a long time. So, if you're going to come off testosterone, it can take up to about 6 months on average
Wow.
for the sperm production to come back. So that's something that you keep in mind. But talk to your fertility specialist about it, because there might be something else that you can be on, which is going to keep you feeling well, but also have a better role in terms of your sperm production.
Oh, that's interesting. I had no idea. So excellent tip number 5 is avoid testosterone and any other what we call exogenous, like anabolic steroids.
Yes,
Yeah.
exactly.
Yeah.
Yeah.
Which is a general health recommendation as well.
Yes.
We do not advocate for anabolic steroids. Okay. So those were 5 super helpful tips. And now we have a couple questions. A few of them I think were answered in your tips. So hot tubs, that was one of the questions, is can I use a hot tub if I'm trying to achieve, can my partner use a hot tub if I'm trying to achieve pregnancy?
Ideally not. So, if you're going on holiday and you're going in for 5 minutes, 1 or 2 days during the holiday, unlikely to have a significant persistent impact on your sperm production. If you have a hot tub at home and you're using it on a more regular basis than that, it's really not great for sperm production. So unfortunately, it's one of those things that you're going to have to temporarily make the sacrifice.
Yeah, but I think keeping in mind that it is a temporary sacrifice.
Yeah, exactly.
Is how you need to reframe it.
Yes.
Right?
Parenthood is all about temporary sacrifices for your children. So this is where it starts when you're trying to get pregnant.
Oh, absolutely.
Yeah.
Another question that we had was, is there such a thing as too much sex around ovulation? Will the sperm suffer?
That's a great question. So when I talk to couples about timing of intercourse, I typically advise that they aim to have intercourse every other day. Now, that's not necessarily because doing it more often is going to have a negative impact, but I feel like recommending that they do it every day is a pretty big ask, for couples that are already stressed out and busy. And sperm typically stick around in the female reproductive tract for upwards of 5 days. So there's really no need to do it any more often than every other day. So certainly you can do it every day if you've got the energy and go for it.
Yeah.
It's not going to negatively impact sperm to any significant degree. And in some cases, so there's a subset of patients that have a high DNA fragmentation index of the sperm. And in those patients, sometimes we do recommend that they actually ejaculate more than once a day, because the sperm that are present in the subsequent ejaculations are healthier. They have a lower DNA fragmentation index. That's a kind of a smaller subset of people, of male infertility patients, but in general, we recommend every other day. If you want to do it every day, go for it. It's not going to hurt the sperm. You just might get tired of it.
It's just not necessary. Yeah, right.
Yeah.
Can you explain to me and the listeners sperm DNA fragmentation?
Yeah, so it's basically they examine the DNA of the sperm microscopically, and it's we describe it as essentially breaks or kinks in the sperm DNA. And those sperm are not sperm that are going to be fertilizing the egg. So a lot of people say, oh, I have a high DNA fragmentation in my sperm. Does that mean I'm going to have a child with some sort of chromosomal defect or abnormality? And that's not really the concern.
Okay.
The concern is more that you'll have more trouble achieving a pregnancy, because those unhealthy sperm typically are not able to fertilize an egg.
Okay. That's really reassuring to hear. Another question is about, so we know for women, our eggs, we're born with eggs, and as we age,
Yep.
the quality
Yeah.
it gets unfortunately lower, and above 35 and onwards becomes advanced maternal age. Is there any concern about male partners who are older and their sperm quality?
Yeah. So it is worse.
Is it?
Yeah,
Yeah.
it is worse. So they, in all semen parameters, as we call them, so the number of sperm as well as the ability of them to swim in a straight direction and the health of those sperm, it does go down as you get older. But compared to the downward fall, I would say, of female fertility, it's not nearly as drastic. So that's why we do see men who can become fathers when they're, 50, 60 plus years old, So it certainly does go down as you get older, but it's not nearly as impactful as the fall in female fertility. So it's usually not a major cause of infertility.
Okay, good to know.
Yeah, they don't have the ticking clocks, so to speak, quite as much.
And lastly, can you explain to me what the 3-month rule is?
Oh, the 3-month rule is basically just to keep in mind that any changes you make may take about 3 months to show up in the actual sperm. So, for example, the sperm that you start making today would be present in the ejaculate in about 75 days. So, if...
Wow.
Yeah.
I did not know that.
Yeah.
Look at me learning.
So when patients come in and we tell them, some lifestyle modifications to try to make, or if we start them on a medication or stop their testosterone or, do a surgery, treat anything really in terms of their sperm production, it's going to take about 3 months before we actually see the benefit show up in the sperm test results. And so it's important to keep that in mind, especially because, of course, time is of the essence with couples and infertility. So, you just have to remember that there is a delay and to sort of just hold the line and keep going to wait for those results. And hopefully they'll show that it was all worthwhile. But, we usually treat people for at least 3 months before we would check their sperm again.
Yeah, and that's hard. Like, that waiting and not having a result.
Yeah.
And I'd hope people that are, experiencing infertility and working through these challenges know that we as physicians appreciate how challenging that is.
Oh, yes. Yeah, it's not easy, putting aspects of your life on hold or, trying to make all these changes for something that may or may not work. But, it's everything you do helps. Every little lifestyle change that you can make makes a difference. And again, it comes back to the team approach. Each partner has to do their part, and so my job is sort of to help the male partner to do what they can do to try and increase the chances.
Well, thank you so much, Dr. Ellen.
Oh, no problem.
For joining me today, and it was really fun to do this together.
Yeah.
And fear not, listeners, if you loved this, because we are going to connect again in the future to chat about circumcision and vasectomies. So if you have any questions about these two topics, don't hesitate to reach out. You can email us at shefoundhealth@gmail.com or send us a direct message on social. We are on Instagram as she.found.motherhood, and you can send us your questions there or via email. And if you like our content, please subscribe, give us a rating. And if you're up for it, take a screenshot of our podcast to share on social, because we want to get this information out into the hands of the people that want to hear it. Thanks for listening. Until next time, stay well, everyone.